Hey everyone, and welcome to Spark Summit. My name is Michelle Unn, and today we're going to be talking about our journey of bringing personalization to customers and patients at CVS Health. I've been with CVS just under 5 years and currently lead the data engineering team for the Pharmacy Personalization Initiative, where my team supports the productionalization of machine learning models to personalize and improve the experience for retail pharmacy patients. Prior to working at CVS, I worked in the public policy and nonprofit sectors, but always with a passion of using data to solve challenging problems. I'm here today with Raghu Naku, who's going to also introduce himself.
Hello, everyone. I'm very excited to be here. My name is Raghu Naka. I lead data engineering team for CVS Health Retail Front Store business. I have been with CVS Health for the past 7 years. And before that, I worked as a consultant for large healthcare and financial organizations. Working for CVS has been a very satisfying experience for me personally. I like the fact that I can do what I love, which is working on innovative technological products using cutting edge technologies to achieve our company's healthcare mission, which is helping people on their path to better health. At CVS Health, I build data platforms, cloud infrastructure, and machine learning at scale. I typically, my typical day would involve solving challenges of handling big data in healthcare space. Today, we're going to cover CVS personalization journey and the lessons we learned during the process and challenges posed by constant growth and ever-changing technological space. And finally, we're going to give a sneak peek on how we are going to tackle these challenges in future using new tools we're currently exploring to strengthen our data architecture.
Great. So before we jump into the personalization, I just want to give everyone a little bit of background on CVS Health as an enterprise. So CVS has a diverse set of assets, all focused towards driving our mission of becoming a healthcare innovation company, with the goal of making quality care more affordable, accessible, and simple for customers and patients. And so at the core of that, we have advanced analytics to help drive and improve the customer experience across the enterprise, whether that's from CVS Pharmacy, the PBM Caremark business, Minute Clinic, or Aetna. So today's focus for the presentation will be on the front store and pharmacy businesses. Both Raghu and I support on the pharmacy and front store businesses. We have about 10,000 retail locations across the country. And so our focus will be on, the journey to drive personalization within those areas.
With all those business lines that Michelle has mentioned earlier, it poses a unique set of problems to a machine learning project of any kind. So for any personalization project, understanding the customer behavior is really the key. So understanding CVS customer behavior is really unique. So we have unique set of customers because we have different large number of microsegments, which poses challenges to understand overall behavior of the customer. Because we have, like Michelle mentioned, we have like 10,000 stores across the United States, and we have pharmacy patients' health needs are varied and sometimes unpredictable. So all these challenges make our customer really unique, and our data is unique too. We are not dealing with a typical grocery store customer. It is really hard to predict a customer behavior of a convenience shopper, because a customer could go to a convenience store just because he forgot milk, or he could go to a convenience store like CVS to pick up his prescription and stop by to grab candy. So it's really the the behavior could be unpredictable, which is why our data sparsity and dimensionality uh, leads into overfitting issues for any kind of machine learning model. And coming to the third uniqueness that I would like to point out is the situations that we typically deal with in a retail front store. For example, the COVID situation will instantly make or has instantly made our static machine learning models either outdated or invalid because the customer foot traffic has significantly decreased or their purchase pattern has significantly changed. So all of the historical behavior that we use to model the customer behavior is completely useless. So these are the three unique things that we would like to point out. And be- before we jump into the personalization goals of CVS, we thought it is really important to understand the CVS customer behavior. When it comes to personalization goals of CVS, personalization is delivering the right individual experience in the right channel at the right time. So we have to provide the customer experience. We have to provide the right experience to the customer or patient, whether it is a pharmacy product or whether it is a reward or coupon that we offer, or whether it is a minute clinic service or health club, or whether they are enrolled in an engagement in a loyalty program like Extra Care card. So it's all about providing the right experience, and it is also important for us to understand what channel the customer would respond better, whether it's a text message or a phone call or an in-store offer. So optimizing our process to come up with a right channel that a customer or patient would respond is also really important for us. And at the timing of the offer as well, right? So if a patient could be up for a prescription renewal, and that could be a right timing to send an offer to the customer rather than the customer already filled a 3-month prescription and there is no reason for the customer to have that trip. Right, so this is one example of the significance of the right timing to the customer, and then the tailored message to the customer is also important to us, or that is one important goal, because a customer preferred language could be different than what we are interacting from. So we define all these goals, and we use test and experimentation framework, which we're going to cover in a later slide, to come up with these various attributes which is going to help us define that 360-degree view of a customer. So in order to support those goals, here is a quick overview of our existing tech stack that we started building for the past year and a half, right? We have, like any traditional company, we have traditional relational data warehouses, and we have several disparate files coming over from POS sales and several other places. And we have used this cloud technologies to ingest all of the data into cloud. In this case, our entire workshop is in Microsoft Azure, and our entire workbench runs on Databricks, of course, which is on Spark, Apache Spark. And we use Airflow and GitLab for orchestration and DevOps as well. We do use Tableau for reporting, both operationally and financial and adherence metrics. So as you could see on the top right corner, our processing layers are pretty typical to a typical machine learning project. We create a unique data layer that would feed into a process where we're going to create our features, and then we're going to create opportunities out of it, which all can be fed into the machine learning models, and then we're going to send these offers to the POS weekly, daily, based on the cadence.
So as Raghu mentioned, our personalization journey started in mid-2018, where initial use case development started. We were able to build our first pilot on-prem, actually in a Hadoop environment, with within just a couple of months of that first ideation. Launched our first personalized offers to 1% of customers a few months later. We quickly hit some roadblocks when we tried to scale up from there, from 1% to 5%. There's actually an actual constraint of being able to build additional hardware to support the scale that we wanted to get to. So at that decision, we made at that point, we made the decision to transition to a cloud-based environment using Azure Databricks, as Raghu had mentioned. So made that transition in early 2019. And from there, we were able to, expand the number of use cases that we were able to support, double the number of personalized products, and then eventually scale to offer personalized offers to patients by the end of 2020. In parallel, we were also, the focus was specifically on, building this test and experimentation framework so that we could, rapidly iterate and test lots of different iterations of giving different experiences to patients based off of the patient segment, just kind of iterate over, incrementally make improvements to the experience we're providing to patients and customers. And so as you can see, this red line kind of shows the size of the team. We started off with a very small team of just a handful of data engineers, data scientists. Quickly, as the use cases and number of products that we were offering through personalization application grew, as did our team size. Luckily, cloud-based infrastructure was able to support and help us to scale up. And we'll talk a little bit more later in the presentation about what that looked like. And so just to give a little bit more context to kind of what personalization really means at CVS, I'm going to give a quick overview of some of the use cases and solutions, ways that we approach personalization, and then we'll dive into two specific use cases, one on the pharmacy and then one on the front store side. And so a couple examples here of just which I think Raghu had mentioned earlier. So we have many of these clinical products, just as we might have many of these coupon offers that we can offer to extra care patients. And really, so it's a scarce resource that we want to prioritize. And so what better way to prioritize than using machine learning to determine the propensity of a patient's likelihood to accept a certain offer. But to start, actually, the offers that we were sending out were very rules driven. So everyone got the same message at the same time through the same channel. So there wasn't actually a lot of data that we had at our disposal to kind of make those predictions. So started off with randomization, testing different channel assignments, different timings, so that we can collect information about patients' preferences and their behaviors. Then from there, move to support both kind of from an experimentation perspective, but also from a machine learning perspective. So we can use the data that we've collected to implement different experiences or different experiments. Segmenting off different populations, maybe age and gender, or age and engagement with channel, and then customize the experience within kind of those segments. That's kind of the concept of experimentation that we're trying to drive, as well as as we're able to collect more and more information, like can use some more advanced analytics like machine learning propensity models, as well as looking for really to find opportunities where we can provide an offer that where the patient is likely to engage with. And so some of the outcomes that we're trying to drive really are centered around kind of healthcare and at least from the pharmacy side, around medication adherence, which I'll speak to in the next slide. But goal is to increase engagement with products that we have, but also to just create a better experience for patients through both the front store and the pharmacy. And so to go into a little bit more depth into kind of one example use case within the pharmacy space, as I mentioned, one of the problems that the pharmacy is well situated to solve and to kind of support patients with is medication non-adherence. So CVS has different, products and services that we can offer to patients that help with, barriers that patients might face to medication adherence. So barriers might include forgetfulness or cost or access, especially now, like with COVID. There's examples of those services could be, reminding a patient to fill their medication or reminding a patient to pick up their medication, providing counseling when we might see indication that the patient is having side effects and has dropped off therapy. Proactively, like offering to refill or to get new prescriptions when a patient has run out of fills on their prescription. And then also, like in times right now with COVID, offering delivery or even free delivery on medication is a great service for patients that might have some kind of access barrier. And so the way that we're able to understand, so goal is to first understand the the patient's profile. So what is their adherence profile? Are they truly a non-adherent patient, or are they it's possible, or are they truly a non-adherent patient, or is it possible for them to have, maybe their prescriber, or maybe they no longer need the medication, or maybe their prescriber gave them a lower dosage, and so they don't need to come to the pharmacy as often. So those are all kind of, conditions in the data that we can leverage to understand better, kind of like the timing of when patients need to come to the pharmacy, so that we can better prompt them in the way that's most meaningful and relevant for the patient. And then I think once we know for the patient, the kind of service or intervention that they might need, we also want to package that for the patient in a way that makes the most sense to them. So things like choosing the best channel that we can reach out to the patient, like Raghu mentioned, like customizing the messaging so that we're reaching the patient in the language that they prefer, and using content that's going to speak to the patient and really help them to engage. And then a lot of this work has also just been about kind of streamlining, creating a longer term approach for streamlining and offering a more omni-channel experience for patients. So we partner very closely with the IT systems at CVS, as well as the delivery channels to ensure a more streamlined delivery system, as well as increasing the personalized content through these channels.
So here is an example of a typical retail front store use case, right? Like we send an offer to the customer through various channels that we have covered before, and that influences the next trip to the store, and the customer presents that offer, redeems that coupon, and then also expands the basket size during that trip. So this is just a typical retail customer journey. And the problem statement that we have is we have to growing the engagement of our most valuable customers is really important, right? For any retail organization, and re-engage the labs customers and engage all active product shoppers is really the core of the problem, right? That's what we would like to solve using the personalization we have built. So the solution that we came up was okay, we need to personalize the communication and provide relevant and most exciting offers using the data from the customer profile, the 360-degree view of the customer profile that I talked about earlier. So how do we do this, right? So we first, track the customer behavior for the past 1 year, and based on the transactions, we understand the purchase behavior based on the brands and categories that the customer will purchase already, and we figure out the customer's affinities to various other brands and categories, and identify their recent purchase pattern on the identified affinity brands earlier, and evaluate what offers exactly matches or correlates with the customer behavior that we have predicted in our earlier steps, and finally we take all of that data and then we use that to identify the customer probability to buy a particular product or to redeem a coupon using various machine learning algorithms. So that's really the core of our personalization engine, like to predict the behavior of the customer, and then make our offers more relevant and more personable. So we started using the linear models like logistic regression, but due to the performance issues, which we're going to cover in next slides, we switched to XGBoost models, which are nonlinear and actually performing really well. And finally, we take all of these outputs and we optimize based on the constraints we have. Right, we have several budgetary constraints, and obviously we cannot give unlimited coupons. So we optimize that accordingly, and then send out those offers to the customer. So typically, at CVS, we don't measure our performance using using sales metrics or anything. We measure as a healthcare focused company. We always try to measure our performance using healthcare adherence metrics, and we saw a huge uptick of 1.6% in overall improvement in adherence based on various analysis that our measurement team has performed. So yeah, we always evaluate our performance based on healthcare adherence metrics versus any sales goals.
So now that we've given you an in-depth look at personalization at CVS, we'll use the next couple of minutes to talk about the growth that was enabled by the cloud-based environment and transition, as well as some of the challenges that we've faced along the way. So first, as I mentioned, kind of the personalization journey, we made that transition to cloud-based environment in 2019, and I think, as I had mentioned, that transition definitely helped to enable us to both get to market quickly, but also expand the application as the use cases grew. So, through Azure Databricks, we have the flexibility to spin up clusters that meet the unique business needs that unique needs that we have to support various business use cases. We're also not restricted by the physical hardware constraints that I had mentioned, and we really don't need to spend as much time worrying about tuning as we did where we were very constrained. So also, just I think another thing to call it is just the ease of use. So Databricks in general, centralizes all of the assets that developers need to make their jobs easy. So putting interactive notebooks in one place, cluster management, performance monitoring, data metastore really makes it easy to onboard and quickly grow the team, as well as it just makes supporting growing use cases that much more easy. Also, just less of a focus on infrastructural support and more focus on the work itself. Although, obviously with the growth that we've experienced over the past couple of years, we've certainly encountered many challenges along the way, many of which we continue to still tackle to this day. So even though, we're, have transitioned to cloud-based environment, like there's still, always going to still be challenges with handling big data. So, the team has explored different optimizations like Delta, partition sizing, really focusing on optimal cluster usage, and we'll continue to push forward in that regard. Second area where has been kind of a core focus of the team has been around cost management. So as the team has grown quickly, and you saw in that graph, as have our cloud costs. And so, there's a lot of different things that we can be doing on our side and Azure and Databricks help to enable some of those things. So we can spin up different types of clusters for different types of jobs. Your ETL jobs can use different cluster and different amount of compute capacity than your model training, than your feature creation jobs. There's also just a lot that we can do from a developer standpoint. So how do we promote best practices within our development team in terms of like best practices of code optimization, leveraging sample data environment, which we've created for the team to use, as well as maxing out when we're we have the capability to auto scale our clusters, but really trying to max out the cluster usage to the best of our ability. Then there's also just some great features provided by Databricks and continually added. So things like cluster policies and pools and different types of jobs versus interactive clusters that we want to continue to explore to really make sure that we're making the most of the the most of the environment and features that are available to us. And then another area of that has been a challenge has been just around the evolving nature of the technology itself. So while cloud-based technology has been around for many years, it's still relatively new within the healthcare industry and CVS specifically. So while we always want to push the boundaries of innovation within CVS, we still have to take into consideration security and compliance and healthcare regulation, all of which are critical that we kind of meet guidelines with. So wanting to test and try new services, but making sure that we're doing that within the constraints of kind of the environment that we're in. And then one final kind of challenge area, just broadly, and then Raghu will jump into a little bit more around some of the challenges specific to machine learning journey itself, has just been around finding talent and continuing to develop the talent on the team. So with the technology being relatively new and constantly changing, it's difficult to find find people to join the team, especially when we're growing so quickly, that have that cross-functional skill set of data science, data engineering, but also kind of understanding of DevOps best practices. And so we've been working to both grow the training opportunities that we present to the team, but also give more informal opportunities to just play around with new technology, test, and also share across the team. So as Raghu's team is focusing on he'll share some of new services that within Azure or other types of tools and technology, like sharing that information across the teams to help kind of cross-train and skill everybody up.
Thank you, Michelle. So while we had our own challenges on in terms of growth and performance, we also have our own set of unique challenges during our machine learning journey, which I'm going to cover quickly in this slide. So I would like to highlight 4 areas where we had our our own set of challenges and how we overcame what kind of solutions that we were exploring, so that it would be helpful for other organizations who are actually starting their machine learning journey. So in terms of when it comes to feature engineering, we have our production pipeline is very feature engineering heavy, and complex feature engineering requires a lot of computing power. So to have a centralized features which can be leveraged across many use cases, it is going to be really, really helpful. Otherwise you would be reusing same features, or using more than needed features, which could lead into overfitting issues. And in model training area, like I mentioned, we have a lot of segments, micro-segmentation, and these disparate use cases require many models to be trained and implemented parallelly. So so that would require a robust pipeline, and we cannot generalize these use cases. A robust production pipeline is required as well, which we were using Databricks jobs pipeline as a production pipeline. And then when it comes to models selection process too, we initially went with, for example, we went with k-means and logistic regression. But however, we quickly realized that logistic regression doesn't do well with sparse data and leads to overfitting issues. And similarly with k-means algorithm, clustering is not suited to solve high dimensionality problem. So we, like I mentioned earlier, we quickly switched to nonlinear models like XGBoost in terms of in terms of implementation, tuning, and pipeline integration. There are various challenges that are involved that we were able to solve. And then in terms of implementation, we have a very initially we went with very manual process, and we quickly started exploring ML flow and Kubeflow to be able to manage our machine learning lifecycle. So implementation is really key as we grow as a team. And when it comes to collaboration, one of the things that we have quickly identified is that people always think data scientists and data engineers, but there is another role in between, which is the ML ops role, which we quickly identified and encouraged the cross training to fill that gap as well, which has clearly helped us scale much more quickly and bridge that gap between data engineer and data scientists. So with those challenges in mind, I would like to give you a quick sneak peek on what we are, how we are solving the challenges that I have just explained in future. So we quickly realized after reviewing our challenges and the way that our pipeline was performing and our growth, and when we observed all of this, we quickly realized that we need to manage and use the right tool for the right job. In other words, so we have a lot of tools that we were exploring, but I would I would quickly point out one huge change in thinking, which is we're going to switch from using CPU-based machine learning to GPU-based machine learning. So we're going to use GPUs as our compute resource for both of our training and inference, and we're exploring rapids. And then another area that we're exploring is Kubernetes as well. So with Kubernetes orchestration, we could use multiple tools and integrate multiple tools into our production pipeline without being boxed into one single tool. So that is another area that we were exploring as well.
And from the pharmacy side, as there's as the use cases continue to evolve, there's an increasing interest in enabling some more real-time use cases. So we've been exploring things like Azure Event Hubs, Kafka, Azure Streaming Analytics, Azure Functions, to try to enable a more real-time, personalized approach for patients. So I think with that, we hope that this presentation was helpful in just providing a bit of context into how personalization, how we think about it through the the healthcare and retail lens at CVS Health. And I guess with that, we'll happy to take any questions, and thank you everyone for joining.